The Tibetan exile community today consists of more than 150,000 Tibetans spread across 30 countries, majority of which lives in India and Nepal. After His Holiness the Dalai Lama arrived in India, he and the Tibetan leadership had the vision to establish Central Tibetan Administration, provide settlements for Tibetan community where we could maintain our culture, build schools with opportunities for both modern and cultural education, re-establish major monasteries and cultural institutions that were destroyed in Tibet. The CTA's 550 vision calls for maximizing efforts to resolve the Tibetan issue in 5 years based on the middle way approach, while sustaining and strengthening the resilience of the Tibetan people for the next 50 years if need be. After 6 decades in exile, the Tibetan community and the leadership is facing critical development and resiliency challenges and opportunities. We hope with your contribution we will be able to overcome them.
The pressure of Tibetans in exile and forces of modern society has taken its toll on Tibetan. There is a declining trend in loss of traditional values, language, and a rapid disappearance of Tibetan masters of various arts and crafts. However, Tibetan Buddhism and Tibetan culture are now prominent and attracting increasing global interest. How does CTA address these challenges and opportunities and play a more significant role in sustaining the Tibetan culture? The important avenues that CTA and the community must now address include making teaching and learning Tibetan more accessible, transforming the monasteries and nunneries into dynamic centers of knowledge and wisdom, improving the international standing and quality of our libraries, museums, and archives. Lastly, encouraging young Tibetan artists.
Tibetan schools are major centers for teaching Tibetan language and culture. There are 67 Tibetan schools in India and Nepal, where more than 19,000 students are enrolled. In 2004, CTA launched its own basic education policy, which aims at providing mother tongue-based primary education, child-centric learning, and teaching traditional values. According to the 2009 demographic survey, the literacy rate of the exile community is 82.4%, and an average of 90% of class 12 students pass their exams. While students are effective at passing their examinations, do they have the necessary skills to succeed in the 21st century? The declining number of students in our schools is a major issue, which is mainly due to migration and parents opting to send their children to private schools. As a result, we are asking, how do we nurture Tibetan students into avid learner and creative thinkers, encourage teachers to be facilitators of learning, strengthen school leadership, realize the goals of CTA's basic education policy, and produce professionals in various fields?
The migration of Tibetan refugees from the agricultural settlements to cities of India and Nepal and to overseas represents the most significant economic development and social challenge for the exile community. Only about 39% of the total workforce of ages 15 to 64 is employed. The traditional source of income for most Tibetan is seasonal sweater selling, 49%, and agriculture, 46%. Although Tibetan community has been successful in many different ways, about 25% of the exiled population still remain near the poverty threshold. How can the Tibetan leadership assure sustainable economic health and resilience of Tibetan community? Here are some of the ideas that we came up with. CTA and the community could consider transforming the Tibetan agricultural settlements to an agribusiness model, managing the entire business from the crop supplies, marketing, and mass sale. This would hold excellent prospects for motivating and utilizing the skills of Tibetan youth with both higher and lower educational levels. Strengthening small and medium-sized enterprises in the community and encouraging entrepreneurship can catalyze economic growth and employment. What are the best ways to make progress on it? Efforts are currently underway to establish a non-bank financial corporation under the laws of India, and over time, perhaps, to establish a small finance bank, providing a broad range of financial products and services like saving, credit, insurance, remittances, and guarantees.
CTA administers around 50 health facilities, 7 hospitals, 5 primary health centers, and 38 clinics. Although declining, TB, hepatitis B, and HIV/AIDS remain as an important public health concern. Another challenge confronting the community is the underutilization of the health facilities. More support needs to be provided to the physicians and the health professionals serving the Tibetan community. There is a critical need for technical expertise within the CTA's Department of Health. What kind of policy changes make us more efficient and sustainable? Currently, the model of providing care is largely facility-based. Adopting a simultaneous community-based service delivery model could be explored. In addition, a large number of Tibetans seek care at both Western and Tibetan medicine hospitals. How can CTA establish an effective communication channel between the two systems and encourage interaction between the traditional and Western medicine doctors in a mutually supportive ways?
While there are many challenges, there are also new and exciting opportunities. The Tibetan leadership under its 550 vision needs your help in formulating a plan to come up with a more innovative and lasting solution and make the Tibetan community more resilient. Thank you.